Ladies and gentlemen, it is my great pleasure to introduce you to Representative Selina Bliss, who is, okay, you ready for this? She is a member of the Arizona House of Representatives. She is chairman of the Health and Human Services Committee, and she is co-chair of the Arizona Bioscience and Healthcare Caucus at the legislature. Please join me in welcoming Selina.
Thank you. Thank you, Joan. Appreciate that.
So when we look at health, it's such a huge thing, right? And before we get into all of those kinds of questions, I'd really like the audience to know a little bit about you and why you chose to serve and why the Health Committee in particular is so important to you.
Yeah, thank you. It's an honor to be here. I'm doubly blessed. I've been a nurse my whole career. I'm licensed 40 years now as of this year. I used my license to practice at the bedside for 37 years. The last 27 of those years, I concurrently taught in a nursing program. So I can't help myself listening to the speakers. I made individual notes based on each and every one of you. So amazing, amazing stories. But I've known I was meant to serve in this position since I was 8 years old. My grandfather served in the South Dakota State House of Representatives for 17 years. Now that was back in the 70s and 80s, a little bit different times, a little different challenges, but he was chair of appropriations for most of that time. And growing up, I saw what he was able to do in that position to help others. The joke in the House was that he held the governor's wallet. So everything that went through spending and revenues as well went through my grandfather. So it's definitely a calling. You'll notice there are several different types of legislators. You'll quickly realize those that were asked to serve versus those that are called to serve. I see some of my colleagues who are asked to serve, they tend to maybe burn out a little quicker. They tend to not come back versus those that are called. Now, granted, I'm only 3 sessions under my belt. I'm in the middle of my second 2-year term, so ask me again in 2 years how I'm doing. We'll see. Thank you for asking, though.
So you just tell us what you need for support so that you do not burn out. We actually have this amazing new tool at AZ Bio called Lifespan Digital Health. I've got to show this to you. So it's a new program that's designed for residents and nurses to help with their mental health so they don't burn out.
You know, that's really important, and that was one of the themes I heard with the postpartum depression aspect, and that's that education and awareness, but it's also the theme of caring for the caregivers. And we have all types of caregivers, those professional paid caregivers, but look at some of these stories, the families. Brad, you started this off with your story, and I was thinking of your parents because my brother suffers from bipolar disorder, and I saw the effect that had on my father, who just passed away last spring. But it really, really was hard on him because Dad was not a healthcare provider, but yet he suddenly was thrust into the court system. He had to be a volunteer lawyer for my brother, a healthcare provider, a social worker. He had to rise to the occasion, and I see that's what your parents did too. Looking at this, the very last story, it's amazing. The families, are we taking care of our families and support systems as well? So thank you for calling out that burnout in healthcare providers, both professional and even non-paid volunteers.
And, you know, when we talk about health innovation, everybody thinks about the drug developer or the device developer or the manufacturing company. But the reality is that those products and services are most likely going to be delivered at the hands of a healthcare professional, or at least the healthcare professional is going to determine the right one, and then we can administer them ourselves. But there is no single piece of that healthcare continuum that's not involved in supporting our patients. And so it's so important that we think about how we can help each person along that way. So, public policy. So you are, at the legislature, you make our laws, you fix our laws when our laws aren't quite right. Really, what is that process like?
Yeah, as a freshman, that was the first thing I realized coming into this position is we basically have 4 roles. If we, as a legislator, do nothing else, our primary job, our only job really is to create a budget. Arizona is a zero-based budget, so we have to come out to zero every year, no debt, and we tend to spend our excess, although we do have a rainy day fund. So while constitutionally we're down there to do the budget, we, oh, by the way, sponsor and hear bills in our committees and on our respective chambers. I quickly realized we also have 2 other roles. We also oversee state agencies, boards, and commissions. In my case, as Chair of Health and Human Services, my counterpart on the Senate side, we both oversee 22 healthcare boards, and as well as state agencies. These come under review every 5 or 6 years or so. So it seems like every January, we're also reviewing our boards and our state agencies toward their metrics and whether or not they're meeting them. Every January, we hear about 5 or 6 hearings. So boards and commissions. And then the 4th role we have are constituent issues, where we hear from you. And we learn from you, what are your priorities? Joan, I have to say, and I share this with the voters, I believe what the state does at our level of government affects your daily life more than any other level of government. If you think about what the federal level's doing versus your county level versus your cities, maybe you live outside of a city or in an unincorporated area, so your county board of supervisors is your next level of government. Well, if you think about the laws we pass at the state, that's affecting you in your daily life more than anything. So that's the policy aspect. I want to share some bill ideas that I'm working on as we speak, where it affects the budget. And I believe that where we put our money where our mouths are. So what we budget is a determination of our policy. What do we hold important? Are we funding education, healthcare, programs that help keep people propped up and engaged in society? Is now a good time to share?
Absolutely.
All right. So what I've learned as a freshman legislator, which I'm not anymore, so I can shed that title, you really need to have stakeholder meetings to fine-tune your bills before you introduce them, because once you introduce them, they go live, and then the press is calling you and your opponents are calling you. And if you make a mistake, now you have to run an amendment, and that's really difficult to do. We do it all the time, but I try to avoid it. So what I've learned by trial and error is to bring in those stakeholders. And what I heard loud and clear from the Multiple Sclerosis Society as well as the ALS Society is they're struggling with prior authorization of treatments as well as continuing authorization. So I'm holding 2 stakeholder meetings for 2 separate bills because I want to get them right. We already met with Dominic Braun from the Multiple Sclerosis Society. He represents New Mexico and Arizona. His is a reauth bill. If you're already diagnosed and you're getting treatment, why do you have to be run through the ringer to continue these treatments? Also, when there's denials, we're looking at the time frame and the contact of how to address those denials, because we want to treat people and keep them healthy while they're dealing with their disease. The ALS Society, our meeting is in December, but I'm really excited to learn how we can better help the pre-auth. Now, if you think about it, I think right now Arizona pays for 65 and up, but some, in rare cases, young people in their 20s and 30s and 40s get a new diagnosis of ALS. Well, we already know the support they're going to need, the physical therapy, nutrition, respiratory therapy. Why are we making them delay their care through pre-auth when we already know what they need? So the ALS Society came to me and said, look, in Arizona, we could do better. And I said, tell me more. And that's how a bill becomes, it goes from an idea, a concept, to an actual bill. I'm looking at Barbie Engel over here. You came to us last year with a great idea on the red caps on opioid medications, where it's a violation of patient privacy when you go to pick up your prescription and the red cap indicates an opioid. Well, how private is that? In fact, now that I go to my pharmacist, I kind of look behind the counter for those red caps, and there they are. Point also being, you brought to our attention in committee when you testified that some, I guess for lack of a better word, kids would go to their neighbor's house and they would look for those red caps because apparently the street value was very significant. So through you bringing that to our attention, we were able to take that as a bill. Your representative, Walter Blackman, from the Snowflake area brought that one in, and we had a stakeholder meeting, so we heard possible opposition, possible support, drafted that bill, had it heard right away in the Health and Human Services Committee, and that got signed off. So good job for you, yeah. I want to say that's the value of being in a chair. You asked earlier about being a chair of a committee. I'm in my happy place right now because as a healthcare provider, I'm in a unique position to speak the language that we speak. And I think being a nurse for so long, after 10 to 20 years, you start to forget that, we need to be careful. The language we use sometimes can be insensitive or sterile to those that are not healthcare providers and those that are new in the system. You can't assume people know things. BJ, you kind of brought that up. The language we use can be a little harsh and the tone. So we have to remind ourselves to slow down and realize what it's like to hear that patient's perspective or the family's perspective. So back to being a chair, what I am as a chair, as well as my colleagues, is we are extension of the House leadership. So the Speaker of the House picks the chair. I was fortunate to be picked based on my skill set for Health and Human Services. I also served in that committee the prior 2 years, so it was not like it was foreign to me. So I do have an advantage on the provider side. However, I'm a little weak on the insurance side, and if you think about it, half of what we hear in our bills on the HHS committee are the payments, the budget, the insurance piece. So I'm always learning, but I'm also learning on the healthcare provider side what we could do better, and I realized we have a lot of work to do.
And I think back of where it was, it's so much better than it was. And, we talk about prior auth and step therapy and all of those things where there were no guardrails to help patients. And Arizona actually has some of the best laws in the country around those things, and we're still looking to make them better.
Yeah, you bring up a good point. When someone brings up an idea for legislation to us, we'll commonly first ask, well, what are other states doing? We want to know in these 50 labs of democracy, how other states manage their own unique situation. Maybe it's been tried in another state and it did work or it didn't work, and here's why. And then we can take it and say, okay, let's overlay that on the Arizona revised statutes and our Constitution to see if this is something that would fit for us. So we appreciate as legislators hearing, you're doing real well here. I get worried when I hear, but you're behind in this area. I was just, your flyer here on the closing the gap between cancer research and the cancer patient. We have other states that are doing better in pediatric cancer research. That's just been brought to my attention. So I'm working with stakeholders that go around the country and look at individual state laws. You'll see this a lot. In this case, it's raising funding and attention toward pediatric cancers. So I see myself as a facilitator. I see the good work the groups are doing, AZ Bio, as an umbrella to bring in these people so that we can have these conversations. What can Arizona do better in the healthcare and healthcare sciences, and especially in research?
Yeah, and it's interesting. So you have been a champion for the Arizona Health Innovation Trust Fund now for a number of years, and we got some funding this last session for veterans to do a special program for veterans. The challenges, and I know you get this and I do too, every group comes in and says, we need funding for this, we need funding for that, we need a special cancer fund, we need a special Alzheimer's fund, we need a special rare disease fund, and we are a net zero state. We do not budget that way. And so I think, the opportunity that we have to get creative with the structures we already have, like the Health Innovation Trust Fund, and figure out how we address some of these things within it, is a great opportunity for us going forward.
Yeah, this is a thin line we walk some days, is what to invest in. What I personally believe, and I think many of my colleagues do, is look for return on investment. For example, if we can keep certain populations healthy, we can actually reduce costs. If we can diagnose early and treat, we can reduce complications and long-term disability, and as well as quality of life. When someone lives quality of life, they can be a productive member of society. So we're constantly monitoring. I think it's smart spending, not so much having to, well, how can we raise money? If I spend $1 on AZ Bio, I can get this many more dollars back. So I think also what's important is when you're cutting a budget in a certain area, don't take the chainsaw, use the scalpel to be very precise. Yeah, sounds like you have some experience in this area. Now, heads up, caution with HR 1, the federal piece coming at us with the state Medicaid cuts. This is going to be top of mind coming at us fairly quickly. We've got Access is our state Medicaid program, and there's some significant projected cuts to healthcare with our SNAP benefits and work requirements. But Arizona, Maricopa County already has work requirements. We are a Medicaid expansion state, so we're going to feel the cut a little more than some of the non-expansion states. So we're already at work. There's a Rural Health Transformation Fund that are grant applications. It's one shot for funding over the next 5 years. It's due mid-November. So we're in a scurry right now to identify what we're doing here in Arizona or potentially could do to tap into those monies. I felt some validation when I saw the scoring system for certain projects, and I thought, oh, I've been running bills in these categories already. Things like scope of practice, allowing physician assistants to practice to the full scope of their training. Same with, been working with the Dental Association, the Nurses Association. I'm one of the past presidents, so I understand the importance of membership associations. I believe strongly in healthcare compacts. As a nurse, my license is good in other states that we share a compact with, but our advanced practice nurses, it's not that case. So I've sponsored last year a bill to bring us into a compact so you can have license portability and cross state lines. I've tried that with EMS. The fire union came out against me. Well, my husband's a retired firefighter. I'm like, wait a minute. You firefighters are telling me, you paramedics and EMTs, you want this for that license portability. So I'm getting mixed messages from their membership. So scope of practice, license portability, some areas in there kind of validated what I've been trying to do.
You mean that when you work in public service and politics, you get mixed messages?
Go figure.
So, okay, this is not a town hall, right? So Representative Bliss has great knowledge and experience around health at the legislature, okay? She is not a federal elected official, okay? And she is not responsible for what's going on in Washington, D.C. If you have, we have time for just a couple of questions. And, we're happy to answer questions. And if you have questions on the federal side, I'm happy to answer those after we have questions for Representative Bliss. But again, focusing on the state. If you were talking to your legislator, which you're talking to the chair of the Health Committee, okay, do you have a question or something that you would like to share with her? Okay. What I'm going to do is I'm going to let you go first, and then I'm going to ask you to be my mic runner for other questions. Does that work? Come on up. Thank you.
I had a really nice shirt on under this, but it's cold in here, so I'm wearing my sweatshirt. For those of you that don't know me, I'm Ashley Chambers. I'm Executive Director of Arizona Families for Vaccines. So we advocate for pro-immunization policy. Thanks. I was on this panel last year, and let me just say, all of y'all that were on the panel this year, amazing. You are incredible, and I was tearing up at everybody's story. So thank you for sharing. It's really impactful. My question is really attuned to everybody on this panel, and my question for Representative Bliss is, knowing how impactful patient stories are, but also I find it very difficult to bridge that gap between patient stories and the ability to come to the legislature on bills. We don't have remote call-in for testimony. So for those of you that don't know, when a bill goes through committee, you can go down to the Capitol, sign in to speak. But unlike some other states, you can't do it remotely. So for people who are immunocompromised, for people going through cancer treatment, for people with ALS, they can't get down to the Capitol to testify. Is there any possibility in the future of maybe changing the rules to make exceptions for people who, because of health reasons, can't get there? That's my question, and I thought it would be beneficial for everybody here to think about something like that.
Well, I always say if I was in charge, having said that, the relationships we build with our leadership is very important, and that's something I could bring back to leadership. During COVID, the lockdowns, that's how we did. I wasn't there yet, but I was watching, I was paying attention, and everything was done remote. So we know it can be done. We are a democracy. We want to hear from our constituents. But Ashley, you already also brought up a good point. When you hear a bill in committee, you're allowed typically 3 speakers for and 3 against, and then an unlimited amount of people can sit in the audience to show support. When we get a large crowd, we do overflow, so we don't like to let people out of that process. But when you pick those 3 strategic people to testify in committee, each only gets 2 minutes. But I quickly realized they have to be 3 unique viewpoints of that bill. The most important speaker is who puts a face to that bill. It's that person suffering from that disease, that disorder, or that injustice of our laws. So they quickly make it real, and I think that's the most important person. The other 2 typically tend to be someone that's like a lobbyist, or I'd like to call them legislative liaisons. It just sounds so much better. They can to answer the tough questions like, well, this is currently in Arizona revised statute, but this is what's missing, this is why we need this bill, et cetera. And then the third person, it can vary depending on the subject of the bill. So your involvement and engagement is extremely important to make it real. One thing we don't like to hear or think we're doing is promoting a bill that is for an individual or a vendor. We want to know we're helping a larger group and not a special interest group. So making it real, there you are.
Awesome, thank you.
Hi, I'm Jordan Burton. I'm at Lifespan Vision Ventures. We're a venture fund that invests in early stage biotech companies. And we're actually located outside of the state of Arizona. And so I heard all of these great programs that are available to investors within the state who invest in Arizona biotech companies. But I'm wondering, with the Health Innovation Fund, and as that starts to increase, how do outside investors invest alongside the Health Innovation Fund and advance biotech research as a whole? I think that's something that a lot of patients here really appreciate knowing about. Thank you.
I'm so glad that you asked that, because that gives Joan an opportunity to do a plug for the Health Innovation Trust Fund, if you haven't already were aware of that. So I appreciate that question.
So thank you, Jordan. So the Arizona Health Innovation Trust Fund is that pot of money that is going to be managed by the state, and then a 4% distribution will go to a nonprofit that will manage that process. And relative to specifically to investments, so the fund's mandate is to do three things: to develop our workforce in health innovation, to support the entrepreneurs, and then to do these mission-related investments so that they hit the milestones so that they start to get to a point where they are investable. So the way that the nonprofit will select which companies it invests in is it will go out to the venture capital community and the strategic, the companies that would help it, and say, okay, we're looking at these companies, you're a specialist in this area, so your fund, for instance, is very focused on longevity and neural disease and things like that. So we would come to you and say, we'd like you to evaluate this, because quite frankly, Jordan's smarter than I am. And so, Jordan, I want you to evaluate this, I want you to score it for me. But the big question is if we can get them further along, would you consider investing in them in the future? And then you get to track their process. That's called syndicating the innovation, and that's a key component of how we'll work together.
Yeah, we're seeing this in other industries that we're bringing to Arizona, so we really want to champion this. We've got a handful of healthcare providers, Representative Willoughby, Senator Champ, that are part of this, Representative Travers, promoting AZ Bio. So we appreciate the expansion and awareness of what we have to offer here in Arizona.
Absolutely. And I think we have time for one more question. Anybody? I got one in the back.
Hi, I was just wondering, is there anything we can do as a community to help contribute to the application that's going in mid-November for the funding that you're looking for?
Yeah, short answer is to the state Medicaid program is Access. They have a portal on their website. They had a request for information. Now that was due 2 weeks ago Friday. So at this point, I personally would have to go back to their website to see what their next steps are. It's going to move quick. Also, you'll want to look up the application to see if what you're promoting or proposing is applicable as well. It's all out there. The application booklet is like 48 pages, but under CMS.
There is, so the governor's office made a call for that, and of course, CMS Access is under the governor's office. And there's information on the AZ Bio website. You can also reach out to me at jkw@azbio.org. That federal grant process is very time-bound. And so the state put their call out to stakeholders for input. That input is now going through a committee scoring process. They then have to give their recommendations back to the federal government, who has their guidelines and scoring process, and then we're all competing for these things. The challenge is right now, healthcare funding at the federal level is a bit of a moving target. And so because of that, everyone is trying to determine the best way to address that. And really, with this federal pot of money, we know that rural hospitals, rural communities, poorer communities are going to get hit a lot harder than, for instance, people that live in a very wealthy community. And so because of that, there's a lot of evaluation that has to go on. I know in conversation with our senators as well as with our members of the U.S. House of Representatives that they are very aware. AZ Bio does a lot of work in gathering input from constituents and then routing it to the right person within the congressional offices, so that they have your feedback so that they can try and do what's best for all of us. And with that, I want to just end by saying, Selina, thank you.
Thank you. It's been an honor.
We appreciate you. And if you want to just stay there, I'm going to do the rest of the thank yous. Thank you to our patient speakers. You always amaze me with your fortitude, with your positivity, with your ability to, really go the distance. And equally important, your willingness to share some of your most private moments. That is not easy to do, and it's extremely generous. So thank you for doing that. To our audience, thank you for listening. To our AZ Bio members, thank you for being part of the tribe that is moving health innovation forward. And to all of our health innovators in the audience and watching, I hope you took really good notes. We have a lot of work to do. Thank you, everybody. Have a fabulous weekend. Bye-bye.